What if I told you that in just a few years, your options for treating glaucoma could look completely different? It might sound far-fetched, but with new breakthroughs on the horizon, the treatments available in 2025 could revolutionize the way we manage this condition. Glaucoma is a leading cause of blindness, especially for older adults, and managing it can be a constant challenge. But what if the answer didn't just lie in traditional treatments like eye drops and surgery? Stick with me, and in the next few minutes, we'll explore 6 effective glaucoma treatments for 2025 that you need to know about, some of which might change the way you think about managing your eye health forever. Glaucoma often develops without noticeable symptoms, making it a silent condition. It involves a group of eye issues that damage the optic nerve, which is essential for vision. This damage is usually caused by a buildup of intraocular pressure, IOP. Since glaucoma progresses slowly, many people don't realize they have it until significant damage has already occurred. Once the optic nerve is damaged, it cannot be repaired. That's why early detection is so important. Symptoms like blurred or peripheral vision loss typically appear in the later stages, causing irreversible damage. While optic nerve damage can't be undone, there are treatments available today to manage the condition and prevent further damage. With new breakthroughs on the horizon in 2025, even more effective treatments are becoming available. Stay with us as we explore some of these promising advancements that could transform the way you manage your eye health. Early detection of glaucoma is crucial because catching it early can prevent serious damage. Think of it like fixing a leaky faucet. If you address it right away, you save yourself from bigger problems. Glaucoma works the same way. When caught early, it can be managed, but when ignored, it leads to irreversible vision loss. Nearly 50% of people with glaucoma don't even know they have it, as it often develops without symptoms. This is why regular eye exams, especially for those over 60, are essential. You don't have to wait for symptoms to appear. Regular checkups are the best defense. If you're over 60 and haven't had an eye exam recently, now's the time to schedule one. Early detection can save you from stress and long-term complications. Treatment number 1: traditional eye drops. Let's start with one of the most common treatments for glaucoma, eye drops. You've probably heard of them, as they've been a standard solution for years. So what do these drops actually do? In simple terms, they lower the intraocular pressure, IOP, which is the main cause of glaucoma. IOP increases when fluid inside the eye doesn't drain properly, and these drops help by either reducing fluid production or improving drainage. There are different types of eye drops, each targeting specific mechanisms in the eye. Some reduce fluid production, while others enhance drainage. The big advantage of these drops is that they're non-invasive, easy to use, and generally safer compared to more complex treatments. They're also a great first step for managing glaucoma before considering options like surgery. That said, consistency is crucial. For the drops to work, you need to follow the prescribed schedule. Missing doses can cause your eye pressure to rise again, which undermines the treatment. It's similar to taking medication for high blood pressure. Skip a dose, and the benefits quickly fade. As for side effects, some people experience mild irritation, like dry eyes or a slight stinging sensation when using the drops. These are typically temporary and should lessen as your eyes adjust. If they become bothersome, your doctor can switch you to a different type of drop. A 2021 study published in JAMA Ophthalmology found that patients who stuck to their prescribed eye drop regimen showed significant improvements in managing IOP. The takeaway? Following your doctor's instructions is key to preventing further vision loss. So if you've been prescribed eye drops, make them part of your routine, and you'll likely see positive results. Treatment number 2: laser therapy. Let's talk about laser therapy, specifically selective laser trabeculeplasty, SLT, which has gained popularity in recent years due to its effectiveness. While the term may sound complicated, it's actually quite simple to understand. SLT uses a focused beam of light to target the eye's drainage system, which controls intraocular pressure. The laser helps improve fluid flow, reducing the pressure that causes glaucoma. For people who have difficulty with eye drops or haven't seen enough improvement from them, SLT offers a non-invasive, safe, and highly effective alternative. One of the main benefits of laser therapy is that it's quick and recovery is usually easy. Many patients can return to normal activities the very next day, making it a great option for older adults or those with busy schedules. The procedure takes little time and is typically done right in the doctor's office, eliminating the need for a hospital stay. Research supports its effectiveness as well. A 2023 study published in the British Journal of Ophthalmology found that SLT successfully lowered intraocular pressure in over 75% of patients with minimal side effects. Because of these results, many doctors now recommend SLT as a first-line treatment, especially for those struggling to manage glaucoma with eye drops alone. It's worth noting that SLT is not a one-time fix. Some patients may need follow-up treatments. But the good news is, SLT doesn't carry the long recovery times or complications that are often associated with more invasive surgeries. If you're having trouble managing your glaucoma with eye drops, SLT could be a promising option to discuss with your doctor. It might be just the solution you need to improve your condition and get the relief you're looking for. Treatment number 3. Oral medications. For some patients, oral medications may be the right choice, particularly when other treatments like eye drops don't seem to provide enough relief. These medications work differently from drops, as they reduce the amount of fluid the eye produces. The less fluid that builds up, the lower the intraocular pressure, IOP, which helps protect the optic nerve from further damage. Oral medications are typically used when eye drops alone aren't sufficient. Think of them as an additional line of defense in managing glaucoma. The most common class of oral medications is carbonic anhydrase inhibitors, which block an enzyme responsible for fluid production in the eye, helping to lower pressure. However, while oral medications can be highly effective, they come with potential side effects. Some people experience fatigue, tingling sensations, or digestive issues. These side effects are generally manageable, and many patients find them tolerable. If they become too troublesome, your doctor can adjust the dosage or switch you to a different medication. A clinical trial in 2022 showed that oral medications, such as carbonic anhydrase inhibitors, effectively lower IOP with fewer side effects than previously expected. This has made them a viable option for many patients, especially those who struggle to follow a strict eye drop regimen. If you find it difficult to use eye drops consistently or experience side effects, oral medications may offer a more convenient alternative. The key is to work closely with your doctor to find the best treatment plan for you. Treatment number 4. Minimally invasive surgery. Let's dive into minimally invasive glaucoma surgery, MIGS, a treatment option that's gaining popularity in the glaucoma community. MIGS has completely changed the way we approach glaucoma surgery. Unlike traditional surgeries, which require larger incisions and longer recovery times, MIGS procedures use smaller incisions and offer a much faster recovery. This is a great option for those who need more than eye drops or laser therapy, but aren't quite ready for the intensive procedures associated with traditional surgery. MIGS works by improving the drainage of fluid in the eye, reducing intraocular pressure, IOP. There are several types of MIGS procedures, but they all share the same goal, lowering IOP while minimizing the risk of complications. One common MIGS procedure involves implanting a tiny device that helps fluid flow more easily, lowering the pressure inside the eye. The best part? MIGS is typically performed on an outpatient basis, meaning you can go home the same day, and the recovery is quick. Now, let's look at the numbers. A 2022 study by the Glaucoma Research Foundation found that MIGS procedures successfully reduced IOP in over 80% of patients. These procedures also tend to come with fewer complications and quicker recovery times compared to traditional surgery. For older adults or those seeking a less invasive option, MIGS could be an ideal choice. However, MIGS isn't right for everyone. While it's effective for many, some patients with more advanced glaucoma may need more intensive treatments. For those who qualify though, MIGS offers a great middle ground between medication and traditional surgery, allowing for a quick return to daily life with fewer risks and good control over eye pressure. If other treatments haven't been enough to manage your glaucoma, it might be time to ask your doctor about MIGS. With high success rates and fast recovery, it could be the solution you've been searching for. Treatment number 5. Trabeculectomy surgery. For more advanced cases of glaucoma, trabeculectomy surgery may be necessary. This procedure is one of the most effective options for lowering intraocular pressure, IOP, in patients who haven't responded well to other treatments. Essentially, trabeculectomy works by creating a new drainage pathway for fluid in the eye, allowing it to drain more effectively and reduce eye pressure. Here's how it works. During the surgery, the surgeon removes a small piece of tissue from the eye to create a new drainage channel. This allows fluid to drain more easily, which helps lower the IOP. The procedure is highly effective, with many patients seeing significant improvements in their condition afterward. That said, trabeculectomy is a more invasive surgery compared to options like MIGS. While it can significantly lower IOP and reduce the risk of vision loss, it also comes with a higher risk of complications, such as infection, scarring, or bleeding. For this reason, it's typically reserved for patients with advanced glaucoma or those who haven't found success with other treatments. Research published in the American Journal of Ophthalmology shows that trabeculectomy successfully reduces IOP in about 85% of cases. However, it requires careful monitoring and postoperative care to ensure proper healing and to maintain control over eye pressure. While trabeculectomy can offer lasting benefits, it's important to have a thorough discussion with your ophthalmologist to assess the risks and determine if the surgery is right for you. For those with severe glaucoma, trabeculectomy may provide a long-term solution for managing eye pressure. It's a procedure with a proven track record, but it's crucial to weigh the potential benefits against the risks before moving forward. Treatment number 6. New advances in gene therapy and stem cells. Looking ahead, some truly groundbreaking advances in glaucoma treatment are on the horizon: gene therapy and stem cell treatment. While still in the experimental phase, these treatments offer incredible promise for managing and potentially even reversing glaucoma. What makes them so exciting is their potential to target the root causes of the disease, offering new hope for patients who haven't had success with traditional options. Let's begin with gene therapy. This approach targets genetic mutations responsible for glaucoma. By introducing healthy genes into the eye's tissue, scientists aim to slow or even stop the progression of the disease. This could be a major breakthrough, especially for individuals genetically predisposed to glaucoma but who haven't yet shown symptoms. Gene therapy could allow for early intervention, potentially preventing the disease or managing it before significant damage occurs. Stem cell treatment for glaucoma is equally promising. Stem cells have the potential to regenerate damaged optic nerve fibers, which is huge because optic nerve damage from glaucoma has traditionally been irreversible. The idea is to introduce stem cells into the eye, which could replace damaged cells and promote healing, potentially restoring lost vision. Though still in early clinical trials, the results so far have been encouraging. A 2024 study in The Lancet showcased the potential of gene therapy to not only halt glaucoma progression, but also reverse some optic nerve damage. These therapies aren't yet widely available, but they represent a major leap forward in glaucoma research. In the near future, they could provide a more targeted and effective solution, fundamentally changing how we approach eye health. While we're not there yet, staying informed about these developments is important, as they could soon be part of mainstream glaucoma care. If other treatments haven't worked for you, gene therapy and stem cell treatments might just be the breakthrough you've been waiting for. Now you've got the inside track on some of the most effective glaucoma treatments available in 2025. There isn't a one-size-fits-all solution. What works for one person may not work for you, but with so many options, from eye drops to gene therapy, you have the power to manage your eye health. The key is to stay proactive, stick to your treatment plan, and regularly consult with your doctor. How much are you willing to invest in preserving your vision? Have you taken the steps needed to keep your eyes healthy? Early detection and the right treatment can truly make a difference. So don't wait for symptoms. Schedule your eye exam today. If you found this video helpful, give it a thumbs up, share it with someone you care about, and subscribe for more health tips. Don't forget to turn on notifications so you never miss an update on staying healthy as you age. And before you go, check out the next video on your screen. It'll help you stay informed and empowered to make the best decisions for your health.